Hey, this is Lisa Shaw, a physical therapist and breathing expert, coming to you today to talk about the breather, which is a tool you can use to strengthen your respiratory system. Today we're going to talk about inspiratory muscle training, which is strengthening the muscles that help you inhale. And typically you would want to do that in a pattern that is ideal. You would want to maybe work on your diaphragmatic breathing pattern as opposed to an upper chest breathing pattern. So look at my other posts on breathing to consider what your breathing pattern is and what pattern you would want to strengthen. There are reasons to strengthen an upper chest pattern. There are also reasons to strengthen a diaphragmatic pattern. So kind of be familiar with what your pattern is and how you're breathing as you use this tool. If you find that you go into a lot of neck and upper chest activity when you use this tool, then you would want to pause, reset, rethink about your pattern and try to quiet that down, because we don't want to be pulling in a lot of neck muscles, or you might develop some tension and possibly headaches. So don't want to do that. But if you have worked on your pattern and you're ready to add a little resistance, then this is a great way to do a training program to strengthen those muscles. Inspiratory muscle training has been shown to improve low back pain, reflux, pelvic floor symptoms, just general respiratory capacity and resilience. And I know we're all thinking about our respiratory systems right now, so it's a great idea to strengthen yours. The black one is for regular use. There's also a white one with blue writing that is for respiratory impairment. So the levels are going to be lower on the white one. Both of these, they're available on Amazon. There's links on my website, myintegralpt.com, under products, and you can just link to them there. And I'm going to just dive right into talking about how it works. It's very windy today. Pardon the wind chimes and the gusts of wind. But I want to say thank you to Mary Massery, who's a PT pioneer in respiratory research. And a lot of this information comes from her and all of her time spent in the research and teaching. So thank you, Mary. And to dive right into how this works, it has an inhale and an exhale setting. We are going to work on just one or the other. Typically, you would do just IMT training for 6 to 8 weeks, or just expiratory muscle training for 6 to 8 weeks. You're really not going to do both at the same time. So starting with IMT, we're going to start with the lowest one, which is 1. The general protocol is work on this 15 minutes a day for 5 days a week. And that's the minimal clinical threshold for seeing improvement. And if some studies say 30 minutes, but you should be fine with 15 minutes. If you want to go a little longer, that's fine too. But you're going to start with the lowest resistance, and you're not going to do the inhalations for a solid 15 minutes. You're going to do blocks of time. I like to do reps because it's hard for me to time myself doing blocks of inhaling and blocks of pause. So I will time the pauses and I count the inhalation reps. So I'm just going to do a couple for you. We're set at 1, which is a pretty light resistance. Also note that this comes with 2 mouthpieces. The round one is more for use in the hospital setting or with patients who can't get as good of a lip closure. The more oval one is going to be more comfortable for you. So you're going to just set your inhale at 1 and you place your lips around it, and you're just going to give a nice inhale, again thinking about your breathing pattern. You really want, in general, more of a lower diaphragm, lower rib pattern. So lips on, and then inhale. Remove to exhale. I like to use a breathing rate of about 3 or 4 seconds for an inhale, 5 or 6 seconds for an exhale. And you're going to repeat that for 10 reps. I won't do all 10 for you now, but one thing to watch for is that you don't get a lot of neck muscle activity. I did with that rep, and so because I'm not paying attention because I'm doing a video, but I want you to kind of be mindful of not pulling in a lot of your upper neck muscles, because we don't want those overworking. We want to strengthen the intercostals and the diaphragm. So about 10 reps, and then to start off with, I like to do 20-30 second rests. So 10 reps, 30-second reps, repeat that cycle for 15 minutes. As you progress, maybe tomorrow, do 12 reps or 15 reps, 30-second rests. And then as you progress through the next week, you want to get to where you're doing 15 minutes of inhalation with this as opposed to reps and rests. You want to gradually increase the reps, decrease the rests until you're just breathing with this for 15 minutes. Once you can do that at that level, then you increase the level. You can go to level 2. And when you do that, you're going to go back to blocking your time again. You're going to go to 10 seconds, 30 rest, and you're going to repeat that. And you're going to work your way up to doing 15 minutes solid of breathing in with level 2. You could do this, if you get really good at the breathing pattern, you could do it while you're watching TV, maybe while you're driving, definitely while you're waiting in carpool lines, that kind of thing. So once you get all the way up to 15 minutes at level 2, you're going to go to level 3, and you continue that. I don't feel like with the black one, you have to go to level 6. Level 6 is a lot of resistance. But I like to try to get people to level 4. That's a really nice level of strength. And when you start out, you're going to be doing this in sitting. Another way to progress is after you make it to level 4, now you try this standing or walking while walking on the treadmill. You go back to blocking your time and work your way up to being able to do it for 15 minutes solid while walking on a treadmill. And that is a fantastic way. Another thing I did not mention earlier is another compelling reason to do IMT is fitness. People notice huge benefits in their respiratory capacity for fitness with IMT. So give this a try and try to progress. If you have any questions about it, call, text, email, and I'm happy to answer your questions. Try it for about 6 to 8 weeks, and after that, you could possibly go to a maintenance phase of 3 times a week if you want to maintain the gains that you made. If you don't do the 3 times a week after that, you're still going to see some long-term benefit, but you won't stay at that level that you reached at the 6 to 8 week mark. And then there's also reasons to do expiratory muscle strengthening, and we can talk about that in another video, but improved cough and some other things. So that's all for today. Thanks for watching.